Assalamu alaikum and good afternoon. I'm 𝗞𝐸 Afsana, I'm professor at BRAC University at School of Public Health, BRAC University. Today I'm here, I'm going to talk about one of the papers which is actually published in eLife journal, which is an open access journal. And in the publication is about the obesity and underweight and how the body mass index actually impacting. So that seems to be very complicated, but it's very simple that we can see that this is a research which have been studies done across the world in different countries, moral studies, third studies, and those studies are all combined together. And the researchers like myself, we are trying to understand that what is the problem here. So what we can see that underweight is actually declining across the world, even in South Asia. And in Bangladesh, it is declining. And then we can see that obesity and severe obesity, these are very important things. So these are actually increasing in many different countries and even in our own country and South Asia as well. But compared to other regions of the world, actually South Asia is still much better shape. So that means that we have to be very careful about these things. So the policy implications is that all the countries should take into account that we need to improve some of our behavior in terms of nutrition, which is actually eating healthy food and how we can make it accessible and affordable. Because we have to understand that many people are not able to buy healthy foods. And also we have to, on the other hand, we have to restrict ourselves and also discourage and also be very motivated not to take unhealthy food, junk foods. But for that, the government should have fiscal and regulatory restrictions. Otherwise, this will continue. And at the end, we can see that there will be more implications in terms of healthcare expenditure and in our everyday life. So it means that this kind of publications, when it happened in open access journal like eLife, so how it is benefiting other people. So people means at the country level is the government, the policy makers, and the practitioners and researchers, academics like us, and many other people, even the common people. So sometimes we don't understand the language of the research because it's a little bit difficult. But in terms of body mass index, which is really important to understand, body mass index is like your height, weight, that kind of proportion. And we have to keep in mind that this is so important for us that would actually have implications in terms of having non-communicable disease. So all the behavioral change is so important, and as I can also again congratulate our BRAC University that how they have taken that initiative to encourage that open access publications in different journals. So I'm very fortunate that I'm one of them who has contributed to this paper. Thank you very much.